I'm going to share a little bit about my journey over the last 15 years. 2009 started off as such a great year. My husband Steve and I got married in March. We blended our families after 5 years of a lot of ups and downs. We married on the beach in Hawaii and came home to celebrate as a family. And in July, we did another ceremony to include our kids and really make that family, blended and a real thing. And so the beginning of that year started off so amazing and things were looking so good. And little did I know what was going on inside of my body. I was working as a paramedic and I loved my job. I absolutely loved being a paramedic. Steve and I both had started nursing school and had planned to be traveling nurses when the kids were grown. This was going to be our plan. He was also a paramedic at this time. But that year I started experiencing some right shoulder pain, fatigue, heartburn, and some GI issues. But I carried a pack and monitor on my right shoulder. I worked 24-hour shifts and I was a mother to 6 kids, so I thought I should be tired. And we didn't always eat at the best time of the day and tended to eat fast and drink a lot of caffeine. So it made sense to me that I had GI issues. It wasn't until Steve and I were attending a critical care nursing course that I had some severe upper right quadrant pain, and the docs there thought I might have gallstones, and I thought to raise the issue with my primary care doc. So when I returned home, I had an appointment for something totally different, but I mentioned it to him. And thankfully, my doctor sent me for an ultrasound and said, you don't have gallstones, but you have a big mass on your liver, which led to many tests and ultimately to the day that I'll never forget. December 1st, 2009 was that day that I heard those 3 words, and I'm sure like many of you, you probably remember where you were, what you were doing, and we'll never forget that. But those were the only 3 words I heard: you have cancer. And then I couldn't remember anything that happened after that. The most important thing about December 1st, 2009, though, was that it was my son Skylar's 14th birthday. And I could have never imagined the effect my diagnosis would have had on him at the time. I remember taking him and his sisters to dinner that day and then to the movies, them not knowing yet, and my husband and I holding hands in the dark during the movie, crying. We were told it was most likely cholangiocarcinoma, and I'm sure like many of you, you were cholangio what? I'd never heard that word before, had no idea what it was, but that it was most likely, or it was a rare bile duct cancer, diagnosed in a late stage. Surgery was the only potential option for a cure, and even if I was able to have surgery, that the recurrence rate was quite high. So I remember my first major decision to make was to find a surgeon. And we did get a second opinion at Mayo because I am from Montana. But for personal reasons, I did choose to stay home and have my surgery in Billings, Montana. So on December 21st, which was 3 weeks after that initial diagnosis, I had 2/3 of my liver removed. This is the tumor they removed and the scar that I'm sure many of you have as well. My first post-op scan was about 3 months later, and it showed spots in my lungs. They tried to do a CT guided biopsy, but couldn't get enough tissue. And I remember I had to go in for my first VATS procedure, video assisted thoracotomy surgery, I think is what it stands for, to confirm the metastasis on my lungs. I was now considered a stage 4 terminal cancer patient. I knew that if I wanted to beat this, it had to be something new because what was available was not curative. This picture was taken right after my VATS procedure. Steve graduated from nursing school, and I was still in nursing school because I wasn't giving up and was hoping to follow him a year later. 2010 was the year of graduations. The next graduation was a few weeks later. My daughter Samantha graduated from high school. We attended her ceremony and then immediately hit the road to drive to Minnesota again to visit the Mayo Clinic for a second opinion. Cancer messes with the whole family, and unfortunately, Mayo didn't have anything to offer other than the standard of care, which I could get back home in Montana. I asked my local oncologist to be aggressive and to look for clinical trials. He found one, but unfortunately, 15 years ago, my insurance wouldn't cover the standard of care costs that went into participating in a clinical trial. And I remember how devastating it felt to know that there was an option that maybe could have provided something better, but it was taken away because my insurance wouldn't cover it. And that was my first taste of advocacy, is going to the Capitol in Montana and sharing my story with some other cancer patients And getting a law passed that said insurance in Montana did have to cover those standard of care costs so patients could participate in clinical trial. And I think that's the first time I realized if you share your story, that you can make a difference. I soon found out that chemo stinks because I didn't enter into that clinical trial. I didn't want to put my family in financial hardship, so I didn't choose to pay for the standard of care costs on my own, and I went ahead and started the standard of care of gemcitabine and cisplatin because 15 years ago there was no immunotherapy to add to it. There was no durvalumab or pembrolizumab at that time. I did not do well with chemo. I had a lot of side effects. I did the Gemcis for about 6 months before the toxicity set in with the ringing in my ears, the neuropathy, and then I really had a bad case of steroid psychosis. This picture was the third graduation that year. My son graduated from Navy boot camp, and I was bound and determined to be there, and it was shortly after I'd started chemo, and I remember being so sick during his graduation and just powering through. The second picture is me at the end of chemo after 18 months. And I just remember going through this and looking in the mirror some days and not recognizing who I was. I'd found the Cholangiocarcinoma Foundation earlier that year, and I'd been a lurker. I would read the discussion board carefully because in the beginning, I didn't want to hear any negative stories or any not happy ending story, so I was very careful about what I read. But what I did find was I was able to get on and ask questions and really make a connection with others who understood where I was and the shoes that I was in. It was so helpful to find a community. My words on here of it frustrates me to not have more answers to this rare cancer still ring true today. It was comforting to chat with others who understood how it felt to be in my shoes, and I was grateful to have found a community and the connection that I needed. My husband titled this picture Rough Day, R-U-F-F, me and the dog. It was a rough day that day. My next big decision after having so much toxicity, because this is what most of my days looked like, and actually this is probably a good day. I did not do well with chemo. So it came time about 2 years into my diagnosis to make that decision of quality versus quantity. I didn't want to give up. I didn't want my kids to think I was giving up, but I did want better quality of life for whatever time I had left. I chose to stop all treatments, and then fortunately, about 3 weeks later, I happened to stumble upon a clinical trial at the National Cancer Institute. It was incredible because I wasn't specifically looking for clinical trials after the hard time I had with the first one I wanted to get through. I was literally sitting at the table paying a medical bill when for whatever reason I clicked on the clinical trials link and it took me to this trial. And I read about it and I thought, it doesn't have chemo. It has the initial chemo for a week and I can get through anything for a week, but then after that it's your immune system doing the work. And I remember looking at my husband saying, I think we should try this. What do we have to lose? So we did. We did all the work. We gathered my scans. He drew my blood at the kitchen table. We sent everything off. We called the doctors out there. And in March, I went out for my initial interview. 2 weeks later, I was out there and they removed some tumors from my lungs, 4 tumors. They harvested the T cells from those tumors and grew them in the lab. I returned about 4 weeks later, and for that first week, you receive a cell-depleting chemo to wipe out your immune system. And then the second week, I received 42.6 billion T cells with a drug called IL-2. Before I went out to do that trial, though, I made my family do a lot of family pictures over the last 15 years. You know, I just wanted to create memories just in case. So this was one of the first sets, but it was right before I went out to participate in this clinical trial. So the results of the first trial was I was the 9th person to enter into this trial. I was the first with cholangiocarcinoma, and I was actually the first to have a response. I had an overall shrinkage of almost 30% and had no further treatments for 18 months, and I enjoyed a great quality of life. The first 6 months, tumors shrank. The next 6 months, they stayed stable. And the last 6 months, they started growing again. But, and Dr. Tran will be here later this afternoon to speak on the science side of it, so he can explain the science behind why this worked or why it doesn't work for some people. But anyway, in that 18-month time frame, the scientist wanted to retreat me with another T cell treatment and a more targeted cells. The next time around, they took these specific mutation-reactive T cells that were reactive to one of the mutations in my cancer and gave me more. These were some scans from the first go-around of my T cell therapy, and you can see how some of the tumors shrunk in my lungs and in my liver. So I went back again for more testing and for my third VATS procedure, where they removed more tumors from my lungs to pull those T cells from. In October 2013, I received that second T cell treatment, the TIL therapy, 126 billion T cells, 4 doses of IL-2, but I had tons of hope because when those started growing and I was back at the NCI, Dr. Rosenberg, who I'll talk about later, he was so excited at the foot of my bed, and he's like, we really want to try this again. But his excitement and hope was contagious, and I was so very hopeful that this next go around could be even better. And it was. Again, here's some of the tumors in my lungs and how they started to shrink. The results from the second TIL treatment, I had an overall shrinkage of 50 to 60%, 3 years of a great quality of life because it's that one-time treatment. And even though it's rough, you're in the hospital for 3 to 4 weeks receiving that treatment, I would do it again in a heartbeat. And because of that, they published the science data in the Science Journal, and the New York Times and the Wall Street Journal, they called our family, they did interviews, and they came out, and there was this story that spread overnight. It was crazy, but in that first week of this information coming out, I had calls from patients all over the world, all over the world. They just wanted to know, what did you do? They just wanted to have hope. They didn't necessarily need to know that this exact treatment would work for them. They just needed to know that there was possibilities. Again, here's some scans of those big tumors in my lungs and how they ended up shrinking over that 3 years from the second T cell treatment. And in between all of that, my first time telling this story was at the second annual conference in Salt Lake City. That's gonna make me cry. I remember how nervous I was. It was so scary, but it was so impactful because I shared, and when I was done, there was researchers who came up to me with tears in their eyes, and they were like so thankful. They were like, we've never seen a patient before, and it was so meaningful for them to be able to hear that there was a patient out there and who they were working for. And again, that's where it really matters to share your story and do patient advocacy. And patient advocacy was part of my whole family. Whether the kids liked it or not, they were involved. They made cupcakes, they did bake sales, we dressed green for Awareness Day. And it was definitely a family affair. In January of 2016, 3 years after that second T-cell treatment, the cancer started growing again. They wanted to know why, so Dr. Rosenberg here, they went in and removed more tumors from my right lung and resequenced them and studied them and tried to find out why they were growing. And what they found out, I'm gonna skip this slide because Eric will talk about it later. So fourth lung surgery back, this time it was a thoracotomy. They removed a lot of tumors and they restudied these tumors and they found out that those T cells were still present, which was good. I still had the same mutation that they were reactive to, which was good. But this time there was, the tumors were infiltrated with macrophages that expressed high levels of a PD-L1 protein. So they wanted to treat me with a drug called pembrolizumab, Keytruda, to open that window to hopefully allow those T cells to recognize the cancer again. And that's what happened. I only had 6 doses of pembrolizumab, and after the first 2 doses, it allowed those T cells to recognize the cancer again, and I had increased shrinkage again. And that has been the last treatment I've had, and that was 8 years ago, this past March. And since then, it's really hard for me to say that I'm cured or that there's no evidence of disease. There's still some spots in my lungs, but nothing is growing. And as long as it's not growing, I'm okay with that. As long as it's not active, I'm okay with that. And I've had an amazing, amazing quality of life. Again, some more shrinkage. When I first entered into the clinical trial, I had so many tumors in my lungs that I couldn't walk 5 steps without going into a coughing fit. My kids couldn't hug me without me going into a coughing fit. And I knew after that first cell treatment, by the end of that hospital stay, the cough went away, and I knew something was working, even though they told me I had to be cautiously optimistic. Some of the highs and lows of going through that T-cell treatment was, well, obviously, it gave me a chance to be here 15 years later, but it was complicated. There was a lot of surgeries. There was a lot of inpatient stay, 3 to 4 weeks each time I had that cell treatment, plus the time in there for surgeries. I was happy to be able to find a way to help advance research. If it wasn't going to work for me, maybe it would work for future patients. I got to experience the magic of the National Cancer Institute, the National Institutes of Health. I didn't know that place existed before cancer. I remember, citing papers from NIH in college, but never really understanding what that facility is. And it is amazing, and the doctors and the researchers that work there do such amazing work. But during my time there, my daughter stepped up, and we were invited to the cancer support community. I was going to share my story, but all of a sudden that second T-cell treatment came up, and I couldn't miss that opportunity. My daughter said, "Mom, I'll do it for you." And she did, and she went and shared my story, while I was in the hospital, and I watched from my hospital bed. Another bonus was my nephew and niece live out there, and I got to watch them grow up during all the times I went out there for treatments. Good and bad, for sure. Because I had such a good response to this T-cell treatment, I really wanted to find a way to pay it forward. Back in 2012, I started volunteering with the Cholangiocarcinoma Foundation on that discussion board. I've now come on as a full-time employee for the last 8 years, and I get to lead the advocacy team, which is another miracle and another job that I love more than anything. And as Flavio said, I get to serve as a patient advocate and be the voice for you guys at national panels. And I try to represent our patient community to the best of my ability and make sure that our voice is heard. I've had the opportunity to speak at the White House. I've had the opportunity to speak in front of 9 US senators at the National Cancer Institute, the biggest gathering of senators, I guess, there, and share my story. Incredible opportunities that I would have never had I not gone down this path. And I'm so honored to lead this advocacy team, because when I first started, it was just me for many, many years on the advocacy team. And now we have a team of 9 of us who lead the volunteer initiatives, lead the care teams, lead all the support of helping patients one-on-one. And as Stacy said, we have a newly connected program that we love to be able to connect with newly connected patients and give them the support that they need to make sure that they're not feeling overwhelmed. We want to provide access to the experts, to biomarker testing, to clinical trials, to treatment and support. We have a group of research advocates who really, they're also the voice for our patient community. They serve on many different panels, and it's an opportunity to be a volunteer and to give back in this area. And Stacy talked about the care teams. This was the first care team that was started, and it was a harebrained idea I had when I first came on as an employee. I pitched it to Stacy and Donna, our director at the time, and said, "Hey, this is what I really want to do." I'm super excited to see that Dave is carrying it forward and building care teams all around the US. Hopefully, we'll go internationally someday. Care team event, Duncan wanted me to announced that in Seattle, the care team will be meeting on Friday, September 12th at Fred Hutch in Seattle from 11 to 3 p.m. And it includes lunch. And so we invite you guys all to do that. There will be lots of information on our social media, and we'll make sure we get the information out to you. These are just some of the events the care teams did last year during Awareness Month. And then I just wanted to talk about Awareness Day too. This story really means a lot to me. It just takes one idea from someone to make such a difference. And Cindy Murata came up with an idea of, why don't we get green light bulbs and put them in our porch lights, and then maybe our neighbors will ask us what that means, and then we can talk about cholangiocarcinoma and spread awareness. And that's how this whole Light It Green started in February. And now you, in February, will see buildings and bridges and things lit green all over the world. It is incredible the impact that this Light It Green awareness campaign has had. And Stacy already touched on the annual conference, but I can't say enough about it. It's one of those things where you have to experience it in person to feel the impact. It's like going to a family reunion of relatives you've never, ever met. But I invite you all. This year it'll be May 1st through the 3rd, but every year we offer patient scholarships. And so look for that announcement as well. You can apply for scholarships where we cover the cost for patients to come. And we try to give out more and more every year so that patients can experience the incredibleness of this conference. So for me, I feel that I've come full circle. I started my clinical trial as patient number 3737. I'm now privileged to sit in audiences at big cancer conferences and see Dr. Rosenberg present the data on my personal story. It never ceases to give me goosebumps. I'm also privileged to be one of the patient voices for the Canadian C3 Collaborative, started up by Dr. Rebecca Auer here. Her husband was diagnosed with cholangiocarcinoma about 3 years ago, and she recognized the need for more research in cholangiocarcinoma and applied for and got a grant. So this research will include a clinical trial with TIL like the one I did, and Dr. Simon Turcott, who was my first research scientist out at NCI, he even advocated to have the GI TIL trial at NCI, so I really owe him my life too, is one of the PIs. I'm grateful for the NCI team, Dr. Turcott, Dr. Rosenberg, and Dr. Tran. And Dr. Tran will be here speaking later this afternoon, and the entire surgery branch who saved my life and continue to do research in this area. I'm even more grateful for time. When I was first diagnosed, I just begged God for 5 years. Give me that 5 years so I can get my kids a little bit older. Then I hit that 5-year mark and I'm like, well, let's renegotiate, God. I want to be a grandma. And I'm happy to say that I am now a grandma 4 times over, almost 5 times. I will have my 5th grandchild in December. Sawyer, Gwen, and Tommy, twins that were just born 9 months ago, and Lily. I have reached milestones I never thought possible, like watching 3 of my children get married. Another one will be getting married next summer. And grateful, even in tragedy. I lost my 24-year-old son unexpectedly, the same one who turned 14 on the day I was diagnosed. I'm grateful I was here to help my family deal with this tragedy. I'm grateful I got to watch him grow and to love him for the 24 years I was fortunate to be his mother. Grateful I was able to see him be a brother to his siblings. He loved his brothers and sisters so very much. Grateful I watched him get his driver's license and graduate high school. I'm also grateful to be with him through all of his struggles. I'm just starting to be more open about this story publicly, but I thought it was important to share because it's definitely part of my story too. Cancer affects the whole family, and during my journey with cholangiocarcinoma, Skylar struggled the most. Shortly after my diagnosis, he started hanging around with a different crowd and experimenting with marijuana that led to other drug use throughout his teenage years. It was the most challenging trial as a parent I had ever endured. I would have fought cancer 100 times over not to have had to go through this with my son. And just like cancer doesn't discriminate, neither does addiction. And ultimately, he went through treatment, but only for 30 days because of insurance coverage again. He attended a Christian sober living home in Seattle area and thrived for a period of time. He was rebaptized, learned to manage money, cook, clean for himself, and receive a career pathway. Unfortunately, when he returned to his hometown, he relapsed again. I remember the day he told me his girlfriend was pregnant. I was so terrified and thought at the time that it was the worst thing in the world that could have happened. And looking back 6 years later, it was absolutely the best thing in the world and the biggest blessing to our family. He really did well until about 6 months after his son was born and again relapsed. He headed back to treatment, this time for about 60 days, which in my mind is still not long enough. This time after treatment, he went to live with his older brother Seth in Indiana. He got a job and was working to be able to send for his girlfriend and son. He was doing so well and working hard. And that is why it was so hard to receive the phone call I did on January 8th, 2020 from my son Seth. If this call had come in a few years earlier, I had prepped myself for that call, but I was not ready for it at this time. I had just spoken with Skylar the night before as he FaceTimed his son. He had been sick with strep throat and received a doctor's note to stay out of work for 3 days. That morning, Seth saw him before he left for work, and we know that Skylar went to work that day, but the secretary sent him home because the doctor's note said he had 1 more day out. When Seth came home at lunch, he found his brother on the couch not breathing. Seth called 911 and started CPR on his brother. There was no sign of overdose or anything unusual, and later the toxicology report also came back clean. To this day, we don't know what happened for sure, but I have to believe that the drug abuse contributed to his death. We rushed to his side. His entire family was with him over the next several days. I knew when I arrived by the look in my son's beautiful blue eyes that he was gone. We as a family wanted to donate his organs as a way of making something good come out of something so terrible, and I was so happy to learn that Skylar had already agreed to organ donation on his driver's license. We worked with Donate Life in Indiana. It was a beautiful experience. They did such an amazing job of making our family feel at peace. They helped to create memories for us by recording his heartbeat on these teddy bears. They made one for every sibling, his parents and his son. They gave us imprints of his hands and a lock of his hair with a heart strip. And on the day we took him to surgery to harvest his lungs, liver, and kidneys, all the staff at the hospital lined the halls to honor his donation of life as we walked with him. The longest walk of my life, but the most proud I've ever been of my son. He saved 5 lives that day. One of those lives was another wife, mother, and grandmother, a sister with cholangiocarcinoma. We were able to self-direct his liver to a cholangiocarcinoma patient, which I know would have made Skylar so happy to know he helped someone like his mom. Leah received Skylar's liver after being diagnosed with cholangiocarcinoma a few years prior. Leah lived for 13 months after her transplant. She passed not due to liver issues or recurrence, but due to COVID. It was so unfortunate to hear this news. Her family was so scared to tell me as they were afraid I would be disappointed about giving Skylar's liver to her. I was absolutely not disappointed. I knew I would have given anything for another 13 months with Skylar. Leah's husband, Wayne, said those 13 months were filled with memories of a great fishing trip with her kids and amazing quality of life that was so cherished. I'm so grateful her family had her for those amazing 13 months. And lastly, I'm so grateful for being a part of the Cholangiocarcinoma Foundation and the cholangiocarcinoma community. It has given me an opportunity to help others, a platform to have a voice for patients with cholangiocarcinoma, and a chance to have a family I would not be part of had I not been given this path. I'm sorry for the reason that you guys are all here today, but I want you to know you're a part of a family and that there is such strength in community. Thank you all.